Section 1, Balance section. Sitting balance. The patient scores a 0 if they lean or lean to one side, slide down in the chair or hold on for support. The subject earns 1 point for being stable and steady in the chair. Second is rising. Ask the subject to rise if able, without using their hand to push off. 0 points are earned when the subject depends on the examiner's assistance to rise from the chair. If the subject uses their hand, they receive 1 point. If the subject rises to the standing position without using their hand to push off, they receive 2 points. Third test, attempt to arise. How many times while attempting to arise does it actually take the patient to get out of a chair? The subject earns 0 points if they must depend on the examiner for assistance to rise out of the chair into the standing position. If a patient begins by rocking or scooting forward but require additional attempt to stand, they receive 1 point. If the subject is able to rise out of the chair in the first attempt, they achieve 2 points. Fourth test, immediate standing balance. How well can the patient hold their stand in the first 5 seconds upon arising? 0 score means unsteady. The patient looks kegel, move feet, mark trunk swing. 1 score means steady but use walker, can or other object for support. 2nd score means steady without walker, can or other support. Fifth test is standing balance. How well can the patient maintain their standing balance for longer than 5 seconds? If they are unsteady, they will score 0 points. If the patient is steady because they are standing with a wide stand, their heels are apart, or because they are using a can or walker, they will score 1 point. If they are standing steady for over 5 seconds with their heels close together, and they do not require support of standing, such as can or walker, they will score 2 points. Sixth test is nudge. Safety is always the first priority in this test. You must be prepared to slowly lower patient to the chair when they perform this maneuver. Since it is possible that they may fall, typically the patient will be standing just in front of the chair. So if they do fall backward, they should be gently lowered onto the chair. The patient should be standing with their feet as close together as possible, as steady as they are able to achieve. Push posterior with a firm graded pressure on the patient's sternum with the palm of your hand 3 times to provide the nudge. If the patient begins to fall, they score a 0. If they stagger or grab at something but can recover, they score 1 point. If they are steady, they score 2 points. Seventh test is nudge, eyes closed. The patient must have completed the eyes open nudge successfully to perform this maneuver. If so, ask the patient to close their eyes. Repeat the nudge as in number 6. You will watch to see whether they are able to remain steady in their stand. If they are unsteady, their score will be 0 point. If they are able to remain steady while they are without using visual input, they will be given a score of 1 point. Eighth test is turning 360 degrees. Ask the patient to turn 360 degrees or to turn all the way around to the position they were into to begin with. It may be helpful if you demonstrate what you mean before asking the patient to do it. If the patient has discontinuous step, start, stop, then they will be given a 0. If the patient can turn in a nice, smooth, continuous circle, they will score 1 point. While the patient is doing this maneuver, you should also look at the steadiness of their movement. Do they grab at something or stagger? If they look unsteady on their feet, they will score 0 point. If they remain steady throughout the turn, they will score 1 point. Lastly, is sitting down balance test. Ask the patient to sit down in the chair. If the patient misjudges the distance and falls into the chair, they will get 0 point. If the patient uses their arm or can sit down in a smooth motion, they will score 1 point. If they are able to sit down safely with a smooth motion, they will score 2 points. Second section is gait section. First test is initiation of gait. Immediate after being told to go. If they hesitate or if take several attempts before they are able to begin walking, the patient gets 0 point. If they begin without hesitation, they achieve 1 point. Second test, step length and height. Total possible point in this component is 4. Right swing foot, 0 score fail to pass left stand foot with step, 1 score pass left stand foot, 0 score fail to clear floor completely with step, 1 score completely clear floor. Second is left swing foot, 0 score fail to pass right stand foot with step, 1 score pass right stand foot, 0 score fail to clear floor completely with step, 1 score completely clear floor. Third test, step symmetry. 0 point means right and left step length unequal. 1 point means right and left step equal. Fourth, step continuity. 0 point stopping or discontinuity between steps. 1 point step appear continuous. Part test. Observe execution of either the left or right foot over about 10 feet of the course in relation to a path width of approximately 12 inches. Mark the deviation is 0 point. Mark deviation of using walking aid gains 1 point. If the patient's foot is able to stay within that width without a walking aid, they achieve 2 points. For the trunk test, observe the trunk of the patient as they are walking along to see whether the trunk is swaying or shifting from the side to side. If there is marked sway, or if the patient has to use a walking aid such as a cane or walker, they score 0 point. If there is no sway but the patient is flex at the knees or back, or if they spread their arm out while walking to improve their balance, they will score 1 point. They achieve 2 points without trunk sway, without flexion, without spreading arm, without using walking aid. And lastly, for the gait section test is walking stance. Evaluate the patient walking stance. How close together are their heels as the patient walks along? If they require a wide stance, such as shoulder distance apart, in order to maintain their balance, then the patient will score 0 points. If their heels are almost touching their walk along, that is a normal gait and they will be given a score of 1 point.